Baby teeth can develop decay too, and some damaged primary teeth may be processionally restored when appropriate. A dental professional first evaluates the damaged baby tooth to determine the extent of decay and appropriate treatment. The dentist assesses how much tooth structure is affected because treatment choices depend on the depth and condition of the decay. If restoration is appropriate, the tooth is carefully prepared so the damaged area can be professionally treated. During restoration, affected tooth material may be carefully removed while preserving as much suitable tooth structure as possible. An appropriate restorative material may then be placed to rebuild the prepared area and restore the tooth form. The restoration is carefully shaped to recreate an appropriate contour and functional surface for the primary tooth. The restored tooth is carefully finished and checked to evaluate its shape and the completed professional restoration. Restoring a suitable baby tooth may help preserve it, but treatment depends on the tooth's individual condition. This video is for general education only. For a child's dental concerns, please consult a qualified dental professional.